Now, the American Cancer Society is issuing new guidelines for people between the ages of 45 and 50. Until now, they could wait till 50 before being screened for colon cancer, but now they're being told to start getting checked when they turn 45. The advocacy group cites a dramatic rise in the rates of colon cancer and deaths from the disease among people younger than 50. A government advisory group still says wait till 50, but the Cancer Society says the danger is too urgent to ignore. Well, Dr. Vincent Obias is the chief of the Division of Colon and Rectal Surgery at the George Washington University School of Medicine, and I hope I got you right. Thank you for joining. I got your name right is what I mean. Thank you for joining us. Help our audience get up to speed. What exactly is colorectal cancer?
Sure, thank you. Colon cancer is a type of tumor or mass that's growing within the colon. It can spread most commonly to the liver or lungs and even into the brain. And just like the mentioning in the American Cancer Society, we have seen an increased incidence in younger patient populations. The SEER database based in the US has shown an increase from 2004 to 2014, 1% every year. Overall incidence is quite low, but it is alarming, and it's triggered this change in guidelines from at least one society.
So what are the new guidelines calling for?
So the new guidelines are calling for screening of the colon at age 45 if you have normal risk factors. So for an average individual at age 45 with no increased risk factor, they're saying you should have some imaging of the colon of some type, whether it is a colonoscopy or a virtual colonoscopy, but some way to rule out cancer. Now, if you have family members who have colon cancer or even family members who have polyps on colonoscopy, you're at increased risk and should have colonoscopy even younger than 45. But they're now stating that what used to be at 50, we should start looking into doing at 45. Now, that being said, a colonoscopy does have some risks where you can have patients who have, or colonoscopy can have risk in terms of the anesthesia or the procedure itself, but the colonoscopy is the best modality to rule out cancer in the colon and rectum.
It's actually quite interesting that the American Cancer Society is suggesting screenings at 45, but some say 50 is still okay. I mean, why is there not a consensus on the age for screening?
I think that there is a lot of discussion in the literature about going younger than age 50, and I would imagine that the American Cancer Society is probably one of the early advocates for screening at 45. I think within the next year we're going to see other groups starting to echo some of these numbers. I can tell you that in my own practice I have had very young patients, anywhere from their late 20s to 30s, with advanced stage cancer. And the truth is that these young patients had signs of cancer early on, but didn't really register that they were at risk because they were so young. At the very least, when people talk about cancer starting to come earlier and younger, between 24 and 45 and 50, at the very least it puts in patients' minds and people's minds that, you know, these symptoms that I'm having, whether it's blood in the stool or unexplained weight loss or change in caliber of my stool, maybe it might be more than just something benign and I should talk to my doctor about it. But you're right. Right now there is a shift, and whenever there's a shift, it usually is some of this. It usually goes society to society, and American Cancer is the first.
Well, from what you're saying, Doctor, it sounds like there is a rise in the number of colorectal cancer cases in younger people. I mean, what might account for this increase?
You know, that's a great question. Right now, there's a variety of factors that can be associated with colon cancer, such as obesity, family history, etc. But there has not been anything pinned down as to explain why we're seeing colorectal cancer in younger patients. The SEER data demonstrates it, but it doesn't say why it's happening. But I can say, as a surgeon that takes care of colorectal cancer, I have been seeing some alarmingly young patients coming through.
Okay, and just very briefly, I mean, we understand that quite a few of these cases are especially high for people of color. I mean, what can doctors and patients do to help reduce those numbers?
Sure. I think patients have to be aware of their body and their bowel habits. And as well, they need to really understand their family history and understand about their parents and siblings, whether they've had colonoscopies or colon cancer. We have seen incidents of or hereditary association with colon cancer from grandparents, parents to siblings. So they should know the family history and their parents and the siblings, because if they've had colon cancer or even polyps in colonoscopy, then they have increased risks. The other thing is to just generally be aware of the guidelines. If you are age 45 to 50, you should consider having a colonoscopy. If you're seeing some blood in your stool and you're concerned, you should see your doctor to talk about the possibility of needing a colonoscopy. And there are other modalities now besides colonoscopy that can look in the colon to rule out cancer. But colonoscopy, as mentioned, is the gold standard. But certainly I think that patients, it should be more in their mind. It's a top 3 incidence of mortality for cancer is colon cancer, colorectal cancer. And when we have these younger patients coming through, it is alarming. So I think at the general populace, they should be a bit more aware of some of their symptoms and definitely be aware of their parents and siblings and grandparents' family history.
Dr. Vincent Obias, colorectal surgeon at George Washington University Hospital, thank you very much indeed.